understand illnesses such as cancer. In fact, we may never cure it, but an ounce of prevention is worth more than 1,000,000 pounds of cure, says David Agus, one of the world's leading cancer doctors. Today I'm going to inform you on the different types of cancer therapies. According to cancer.org, the average American's risk of non-Hodgkin lymphoma is 1 in 50. I come from a family who has suffered from lymphoma and could possibly be affecting the person sitting next to you, whether it's a parent, grandparent, or other relative. I'm going to talk about chemo and radiation, immunotherapy, and the effects that cancer therapy has on a patient and the people around them. To start off, chemotherapy and radiation are the most common and most known ways of treating cancer. Chemotherapy is the use of potent drugs or chemicals to kill or damage cancer cells in the body. There are multiple ways chemo can be delivered: orally, infusion, as a cream put on the skin, and injections. Although chemo is used to help get rid of cancer, it has serious physical effects on the body. Many experience severe pain, nausea and vomiting, fatigue, anemia, and lymphedema. Radiation damages the DNA within the cells and prevents them from growing and reproducing with the use of high energy rays. The radiation procedure is like getting an x-ray, and for those of you who are not sure what that is like, it's painless and each treatment only lasts a few minutes. Although radiation is quick and painless, radiation therapy can lead to more long-term effects. For instance, one might later on develop lung or breast cancer if they were receiving chest radiation. The second type of cancer therapy I would like to introduce to you is immunotherapy. Immunotherapy can be used in combination with other cancer treatments to treat blood cancers. The article Understanding Cancer Therapy says that cancer cells are altered by mutations so that they contain molecules with specific characteristics non-self by the immune system. Immunotherapy works by two ways. One, by stimulating our own immune system to work harder or smarter to attack the cancer cells. And two, by giving your immune system components such as man-made immune system proteins. Edward Guerin is a doctor who did a study on tumor mutations and immunotherapy. Edward stated, although we continue working to refine our selection of patients for this type of therapy, the identification of a population of patients who are likely to have such a good outcome is potentially game-changing for this group. Radioimmunotherapy is mainly used to treat lymphoma specifically. Now that you're aware of specific cancer therapies and their effects, it can be safe to say that cancer therapy can be a very long and agonizing process for an individual. The Association of Coping Styles with Quality of Life in Cancer Patients says that cancer patients experience a high level of stress caused by disease and treatment processes. Coping methods vary from each individual. Some are overwhelmed, some are in denial, some are angry. Many are fearful, depressed, stressed, and some even cope with hope. Physical appearance plays a key role in an individual's coping method. During any cancer therapy, a person's physical appearance can change drastically. This potentially decreases self-esteem, self-confidence, their social life decreases. People affected by this change ultimately have a decrease in their social life, which brings me to my next point. Patients experience cancer need a strong support system through the process. About 10 years ago, my grandma, Shada Dolzman, was diagnosed with lymphoma. She chose to proceed with chemotherapy, and although I was too young to fully understand what was going on at the time, I do remember my dad going with her to her treatment appointments very often. 3 years of treatment and constant family support, my grandma became cancer-free. Unfortunately, she's no longer with us today, but my dad believes that because of his ways of coping, it helped her get through all of it. After asking my dad how he coped with his mother having cancer, he said he would try his best to encourage always looking at the positives. He would find ways to help her relax and do things that she really enjoyed, which is spending time with her family. Now that you know about some different types of cancer therapies and how they affect the patient and the people around them, I would like to finish with a quote from Caleb Mills. You never know how strong you are until being strong is the only choice you have.